An estimated 70% of the drugs regularly administered to children have not been studied with them. This put their health at risk. What does this mean for our children? Should we be concerned? Hello and welcome to today's conversation. I am Tanya McFall Major from the PAHO WHO Bahamas country office. Our topic today is, should health research be conducted with children? Let's welcome our guests for today. We have Dr. Carla Saenz. Please introduce yourself, Dr. Carla.
Hello, friends from Facebook and Twitter. Hello, Tanya. It's great to be with you. I'm Carla Saenz. I'm PAHO's Regional Bioethics Advisor.
Thank you so much, Dr. Saenz. And we also have Dr. Steve Joffe.
Hello, everybody. Thanks, everybody, for joining us today. I'm Dr. Steve Joffe. I'm a professor of medical ethics and health policy at the University of Pennsylvania, which is in Philadelphia in the United States. I'm also a pediatric oncologist, children's cancer doctor, worked for many years taking care of kids going through cancer treatment for other serious diseases.
Well, thank you, Dr. Joffe. It's a pleasure to have both of you here with us today. And of course, we want to welcome our social media audience. As always, share the live stream and join the conversation by posting your comments and questions in the chat box, and our panel will answer them today. So let's begin with today's topic. Why should we include children in research? Either of our panel can answer.
Tanya, as you said at the beginning, many of the drugs and treatments and other things that are used in children, when we take our kids to the doctor, when kids go to the doctor, they get treatments, many of which have not been fully tested in children. And the only way to know whether treatments are safe in children, whether they're effective in children, whether they're good for our children's health, is actually to do the research in children to answer the question in children. We can't simply assume that because something works in adults or because it's safe in adults, it also works or is safe in children. Children are not just small adults, so we can't make assumptions from adults. We actually have to do the research in children.
Indeed. It's because we care about the health and well-being of children that we have to do research in children. We cannot be risking certain things. We have to do research so we can be sure that all the health interventions that we give to children are actually safe and effective with them. So we do it because we care for the health and well-being of children, but also because children, just like adults, deserve medicine and health interventions that are grounded in evidence. It's not that, oh yeah, we adults get medicine that is supported by evidence and we don't worry about offering that to children. It's also a matter of equity. They deserve science based on evidence too. They deserve to have access to the benefits that result from doing research.
And Dr. Carla, based on what you said just now, and that you're right, it is important that we include, and also Dr. Steve mentioned, it is important that we include children because, as you mentioned, they're not little adults. They think differently, they react differently, they feel different. So it's important that we include them. Can you give us an example of a successful study that included children?
There are many studies that have included children, and it's really hard to come up with, like one example, one specific example. But one illustration that I find myself particularly powerful comes from oncology. Mm-hmm. We know that in the late 60s, less than 10% of children with acute lymphoblastic leukemia would survive. And as we have conducted a number of clinical trials with thousands of research participants, we know now that over 95% of children with this type of leukemia survive. So we have gone from almost all children dying from this disease to the majority of children surviving from this disease just by doing research. We can study, we can find cures that are safe and effective for children, but research is the only way to do that. I don't know if you want to give another example.
Sure.
Let me add to that example, because those are the kinds of kids that I took care of when I was working as a children's cancer doctor. And as Carla said, back in the 1960s, cures were almost unheard of for children with leukemia. And it's only because doctors and nurses and people all over the world ran clinical trials where kids would enroll in the study and treatments would be tested. And some of those treatments didn't make things better, but many of them actually did make things better. And so over the years, we learned how to go from cure rates that were close to zero to cure rates that, as Carla said, are now over 90%. And that would not have happened if we hadn't had a very comprehensive approach to doing clinical trials and doing research with children. And really the reason that that was so successful is because so many children and so many parents and so many families were willing to enroll in the research and help us improve the treatments for kids with that devastating disease.
All right, thank you both. So let's talk about bioethics. We oftentimes hear about bioethics, but what exactly is bioethics, or what are bioethics, and why is it important when pertaining to children?
You want to go first? Okay, so bioethics is the discipline that tries to elucidate the ethical problems that we encounter in the realm of health. Many of these problems have to do with children. Mm-hmm. So there are very different areas within bioethics. We have the ethics of research. When we do research with people, we want to make sure that people are treated ethically. When we do deliver care, we want to make sure that we deliver care ethically to children, to adults, to the elderly. But also we have another area, which is public health ethics. Public health interventions that impact the public have to be ethical too. So that's what bioethics deals with. And, at PAHO, as you know, we have since 1993 a regional program on bioethics, and we work with countries trying to strengthen our capacity to integrate ethics in all the areas of health.
Okay, so let's break it down a little bit more for someone who may not have ever heard the term ethics. So what exactly is ethics?
Well, I would like to add to what Carla was just saying. For people who are unfamiliar with the concept of ethics or the concept of bioethics, there's all kinds of things, let's just take in science and medicine, all kinds of things that we could do, some of which would be really good things to do, and others of which would be really bad things to do. And so ethics is the field of thought, the field of study, the field of research that helps us to think through what are the things that we should do, because they're good things to do, they're right ways to treat people, they're ways that are just and fair to treat people or that are respectful of people. And what are the things that we shouldn't do because they are harmful, because they are disrespectful, because they would contribute to injustice. Mm-hmm. And so ethics is the field that helps us sort through those sorts of questions. Science by itself can't tell us what is the right thing to do. If we decide we want to try to cure a particular disease, then scientists are the ones who can help us figure out how to do that. But we need bioethicists, or we need ethical thought to say, is it the right thing to do to do this particular kind of research, to enroll children in research? Should we do the research with adults first, or can we go right to kids? Those are the kinds of things that we need bioethics to help us sort through.
It's like every time we deal with questions that is something right, should something be mandatory, is something unacceptable? Those questions are the questions that ethicists try to solve.
Thank you both. So let's move on to our next question. According to Nuffield Council on Bioethics, clinical research involving children is essential to increasing our understanding of childhood conditions and improving healthcare for children. Yet professionals and parents often feel uneasy about asking children to take part in research, for example, because of the potential risk or burdens. But are the concerns of parents warranted?
I think it is actually important and appropriate to think very carefully about when and how children should be included in research. As we've said earlier, it is very important to do research with children and to include children in research, but we also want to make sure that children are very well protected in research. Right. If I'm an adult and I'm considering joining a research study, I can make my own decisions about whether I want to be in that study, what kind of risks I'm willing to accept for myself. But if I'm a parent thinking about my kid, I have a responsibility to protect my kid. And the researchers who are doing research with children have a responsibility to be very protective of children. And that's why pediatric research that enrolls children, has to be very carefully designed to make sure that the risk levels are kept very low, that the kids are getting benefits that are appropriate given the risks of the study, and that we're very careful to be very protective of children, even more so than adults. We need to be protective of adults in research, but we need to be even more protective of children in research.
And sometimes I don't think we ethicists do a very good job informing the population about the mechanisms that we have to ensure regularly that research is done ethically. So it is true that researchers, make sure that the studies is as safe as possible, as beneficial as possible, that the children and parents are involved in the decision-making process. But it's not just researchers that do that. We have another entity, which is a research ethics committee, that will review every single protocol, every single research protocol that we do. Every time people are involved in a study, a research ethics committee will go through every single detail. And research ethics committees will review every study with children too. That means that they will go through all these issues very carefully. And it's not just one person, it's a group, it's completely independent from the investigator, and they will assess if the study can be conducted as planned, or in order to make sure that is stronger from an ethical perspective, whether some things have to be changed. So we want to ensure all investigators, health authorities, society, we want to ensure not just that children are included in research, but that they're included in research ethically.
And both raised some very important points. And it's important that you, as Dr. Carla said, that this information is translated or is shared rather to the general public. I think that would even help ease the parents' concern in advance, so there may be more parents who may be more open to their child participating in the research initiatives. But let's go on. So we've talked about knowing that their children are protected. Is there something you want to elaborate on a little bit more? Because Dr. Steve, you touched it just a bit.
Yeah, I think Carla said many of the important things that need to be said about how we protect children, both through rules that are very carefully protective of children, through committees that oversee the research and make sure that everything is done to possibly protect the children. And then, of course, we have both investigators and parents who are looking out for kids. So if you're a parent and you are considering enrolling your child in research, or you're a teenager, let's say, and you're considering being in research yourself, it's important to ask these questions. What does this study do to protect me? What are the risks that I might be exposed to that I should know about? What are the ways that I can minimize those risks? What are the potential benefits for me of being in the study? Because with research, we have to talk not just about the possible risk, but the possible benefits that you might get out of being in the study. And so very important to the protection of children is also the children asking questions if they're old enough to do so, and their parents asking questions on their behalf.
And I want to add that we do this assessment, we go through all these points, not only for biomedical research, not only when we're, for example, like testing a new cure or a new drug. We do this for every study that involves children. There are a number of studies, for example, that are surveys that get administered at schools. You have an ethics review committee going over every aspect of that. For example, say a sensitive question is going to be asked. We want to make sure that the kid sitting next to, sometimes at schools, kids sit next to each other, that the other kid cannot see the answer, because bullying is a risk that we want to make sure doesn't result from the study. So I think that we, as I was saying before, we ethicists don't do a very good job explaining to the public the extent to which we scrutinize every single aspect of research to ensure that we advance ethical research. And I think that's why having a session like this is so great.
That you both raised such an important point. Adults must give their informed consent to participate in research. What happens if the participant is a child? can children authorize their participation?
In most cases, if a child is young and can't give their own consent, or if they're not legally able to give their own consent or permission, then their parents will step in on their behalf and be the ones to make the formal decision about whether the child can be in the research. Now, if the child is older, let's say they're a teenager, we also want the child, if they can and if they're interested, to be able to speak on their own behalf. So we give children an opportunity to say, I would like to be in this research, I've learned about it, or I don't want to be in this research. And we want to make sure that children's voices are heard too, to the extent that they're capable of giving their own opinions. So we want to talk with children. We want to make sure the child understands what they're getting into. And we want to make sure that we've heard their opinion. But at the end of the day, if the child is not able to give a legal decision, then it's the parent who has to be the one to authorize their participation on their behalf.
And I think it's very important to keep in mind that not just children, people, we have an evolving capacity to give consent. It's not that you go from not being able to understand anything to just being capable of deciding on your own. You know, first, when you're 8, 10, okay, you might not able to provide consent, but it doesn't mean that you don't understand anything. So research ethics committees work on ensuring that children are involved in the decision-making process as it is appropriate given their capacity, given their age. And It's also important to take into account that children have their own concerns. You know, children often are worried about whether they'll be able to, if they may want to participate in a study, but they may want to know, hey, will I be able to spend time with my friends during the weekend? Or, you know, we do in the region of the Americans, we do many studies on parasites with children. And, you know, they when they give samples, bring samples to school, they're like, oh, will other kids see this? Will other kids, or studies involving weighing children. They want to make sure that others are not there, other kids are not there to see how much they weigh. So there are important concerns, and we're very clear that participation in research is an altruistic act, and it's not just about making sure that they're not harmed. It's about making sure they're treated respectfully, ethically throughout the process, from the moment when they're considering the possibility of participating through, you know, the entire conduction of the study and afterwards. Imagine you participate in a study on a cancer treatment. You want to know whether that worked or not, and that's part of treating people respectfully.
I'd like to add also that if you're in a study, just because you've joined a study or your child has joined the study, that doesn't mean you're stuck with the study until the end of time. So if you join a study and then you discover a month into the study that it's too many visits, or your child is having, you know, seems to be having side effects or something like that, people are always free to leave studies. And that's a very important thing to remember, is just because you make a decision, yes, I'm willing to join the study, yes, I'm willing to have my child join the study, there's still the possibility that you might change your mind because circumstances in your life change, or because you learn something about the study. And you can always step out of the study if you decide that that's the right thing for yourself or the right thing for your child.
Thank you so much, both of you. So in the case of COVID-19, do vaccines need to be studied with children, and why?
So I think it's very important that, again, just like with other drugs and other treatments, we can't make the assumption that just because something is right for adults, that means that it's right for children. So just take, for example, size, right? Children, you know, teenagers may be adult size, but younger children are going to be smaller. And so maybe the dose of the vaccine that's right for adults is not the right dose of the vaccine that's right for children. Maybe it's too much. And so we need to learn what's the right dose to give to children. Maybe children have different kinds of side effects than adults have, and we need to know about that so we can use the drugs or the vaccines safely in children. So I think it's appropriate that the vaccines have largely been studied first in adults, and most of what we know to date comes from adults. But it's very important that we don't just go from there to say, well, we can use them in children, that's fine, that we need to now do the studies. We'll study them in teenagers, and then we'll move to kids who are a bit younger, and then to the youngest children, so that we can learn about their effectiveness and their safety and what's the right dose. and how best to use them in children.
Exactly. I think it'd be irresponsible to just start giving vaccines to children without having done these proper studies with children. There's no other way we will know the vaccines are really safe and effective. I mean, dosing is a very important issue. I mean, we think like, oh, they're smaller, so should we give them a smaller dose? But their immune systems work differently too. Right. So how and the other, think of, I mean, I'm not a physician, but think about the other organs. Kids are growing. That means that they're going through different physiological processes. So that means that the same drug can be can lead to different side effects on children. We have to study this with children. And it's all within the context of a study that you get the appropriate monitoring, that parents are involved in the consent processes, that there are all these eyes throughout the process, ensuring that any little signal is responded to, that not just that we're learning from this, but that their health and well-being is being monitored very rigorously throughout the study.
This is a very important point that you just made, Carla. If we just start using things, let's say there's a drug that is approved for adults and people just start using it in children without the research, there's no careful monitoring going on of that, and we're not learning anything from that. Maybe the doctor or maybe the parents are watching to see what happens, but there's not very careful, structured monitoring of what's going on. On the other hand, when clinical trials or research is done with children, there is very careful day by day, week by week monitoring of what's going on with each individual child and with the group of children as a whole. I've been on monitoring committees for clinical trials, including both for adults and for children. And when something happens that's of concern, the committee comes together very quickly to look at that, to say, what happened here? Is there anything we need to do differently? How can we make sure that the kids or the participants are protected? So being in a clinical trial has many layers of monitoring and protection to make sure that everybody in it is as safe as possible.
Thank you both. So we have, go ahead,
Dr.
I just
wanted to give an example. So imagine you take your child to the pediatrician and your child ends up getting a medication that hasn't been properly studied with children. And then next day your kid has some rash. I mean, you'll be thinking, oh my God, what is it? Is it poison ivy? You will come up with any other explanation. You will probably not think that it may be related to the drug. And we will not even learn from that. So you're often undergoing the same risks, but without any monitoring, without any opportunity to take action in response to them. It'd be a lot better to do the same within the context of a trial where there's someone checking every day and going through all the things that could happen. So you don't have as a parent think like, oh, you've been rolling around with a poison ivy again, or something like that.
And that's an important example that you raised, Dr. Carla. Because as you said, if we're not thinking that if we think that it may be attached to something else is the cause of it, and yet we're still giving that child that medicine on a daily basis, the symptoms become more adverse. And who knows, something like that can lead to hospitalization or something worse. So like you said, it's important that we have children involved in the process so we can ensure that the process was effective. We can understand what has happened with other children so we can know, so the manufacturers of the various drugs can know what changes need to be made so we can ensure the health and the well-being for our children. So as we wrap up, we have about 2 more questions left. Our next question is, how can we promote ethical conduct of research with children in our countries?
I'll start with that since it's for our the region of the Americas, thinking mostly Latin America and the Caribbean. I think we have so many things to do to improve the landscape for research with children. First of all, we need to do some advocacy. We have to understand the importance of doing research with children. Second, we need to work with health authorities and with research ethics committees so they can do an appropriate, rigorous, ethical oversight of research with children. In some cases in the region, we have very restrictive policies for research with children. And it's not that people had an ill intent. It's not that they did this to harm children. It's that they were afraid. They thought that, oh, children cannot decide on their own the way an adult does it. Right. So let's just restrict as much as we can research with children. But that's really not helping children. So we need to ensure that the regulations are in accordance with our ethical guidelines, and that the relevant capacities are in each of the countries to ensure that we can do this ethically, that committees can evaluate studies rigorously, that the health authorities can do the proper oversight. So there's a lot to do, but we also have to do this. Like, it's not just advocacy with those leading the field. We need to do advocacy with the general public, because people have to see the value of doing research with children, of taking part of research with children. And I think COVID-19 has brought very bad things, but some good things have resulted from the pandemic too. It has brought a lot of attention to the importance of research and the importance of doing research well. So I think it has allowed us to take some important steps, sharing with the public how valuable research is and how we can do it ethically.
Right. Thank you.
Let me add that if your child is affected by a particular disease, or if there's something that's in your family or something that you care about in particular, work with the doctors and the nurses and the clinics and the hospitals that treat that disease to say, how can I support the research that you do? How can I learn about the research that you do? What is it that we can do as parents, as communities, to support research that is important to our families, to our communities? And on the political scene, I think if there are particular conditions that are particular problems for communities, for countries, to advocate for more research in those areas. If there are things that are really affecting the health of children, to advocate for actually doing research in those areas, and then asking the questions, okay, now we're doing more research for this particular disease that's a problem where we live. What can we do, or how are we making sure that research is done ethically? How are we making sure that there is appropriate oversight, that there is appropriate education of the public, that kids are being protected in that research?
All right, thank you both. And so our last question is, where can we find information about research being conducted on children, with children?
Well, WHO has a platform that is a mega platform of registries of clinical trials, and it's called ICTRP. In many countries, there are registries of the clinical trials that are being conducted in the countries that get all included in this big ICTRP platform. One of the registries that is part of this ICTRP platform is Clinicaltrialsgov. You can go to Clinicaltrials.gov. It's the most prominently used in the region in English. You can go to Clinicaltrials.gov and you can check there. It's just like it has a search engine. You can just click on children and the condition that is the topic of the study and the area, and you can find all the studies there. In the region of the Americas, we still face the challenge of making this information about which studies are available more publicly open to the populations. And as Steve was saying a moment ago, very often, I would say in the majority of the cases, potential research participants or the parents or guardians or potential research participants find out about possible studies through their pediatricians, and the physicians may know, hey, there's a study in the area for this condition. Do you want your child to participate? But I think we still, given that we have better tools now with social media, for example, better internet sites, I think we still have to do a better job making that information easily available to not just parents, children, adolescents, but the population in general.
Right.
Yeah, I would emphasize the importance of clinicaltrials.gov, which is a website that you can go to and you can put in the name of the disease and you can click a button that says children and it'll give you a list of clinical trials for that disease that is open to children. And you can even say what countries or what regions of the world you're interested in. But I would also add, with the increased use of social media, parents and families are really connecting with each other and becoming resources for each other. So if there's a particular condition that's affecting your child or that is in your family, if you join a Facebook group or a social media community of people who are interested in that condition, then pose the question to other parents who might have been through this before you and say, what can you tell me about clinical trials or research that's being done on this condition that I care about a lot because it's affecting my child? And parents are really becoming major sources of information for each other. We don't only have to go to doctors and nurses and hospitals. We can talk to each other now and learn from each other.
I want to say a special thank you to our panel. But before we conclude, you both can give your final thoughts before we leave.
Well, it's been a pleasure to have this conversation with you both and with our friends in the Facebook and Twitter community. Perhaps one thing that I didn't get to say that I find very interesting is that there have been studies conducted with children about their perceptions about participating in research. And what we have learned is that children do care about participating in research. They tend to really value the possibility of being engaged in an activity that may improve the health and well-being of other children or other families. So I think that's also important. Children, yes, they're young, but they still share so many of the values that we have. It's not that you become altruistic the moment you turn 18. Children also care about helping other children, and this is something that that I don't think we sufficiently discuss. We have to continue doing research, advancing. At PAHO, there's a phrase that we always use. It's like we're here to catalyze ethical research that improves the health and well-being of our populations, and that includes research, that includes children. It is no longer as acceptable to leave children behind from research efforts.
Thank you, Dr. Carla. But before we go, we actually have a question from social media that Dr. Steve, we'd like for you to answer. The question is, how can we deal with the offer of adult medicine against cancer using in children?
So that's a great question, and actually is very closely tied to the final thing that I wanted to say. So let me answer the specifics first, and then I'll generalize. If you are affected or your child is affected by cancer, and you talk to the doctor and the doctor proposes using a medicine, I think it's important to ask the question, so what do we know about this medicine from children? What do we know about it from adults? Has it been studied in children? And if the doctor says, well, we know it's been studied in adults, maybe for a different type of cancer than your child has, I think it's important as a parent to ask some very hard questions about, well, why do you think this is going to be helpful for my child? What do we know about the safety of this medication in children? What research has been done in children to say that this medication is safe for my child, that this medication is likely to help my child's cancer? And the important point there is, without the research in children, it may be very hard to answer those questions. Now, it might still be the right thing to do to accept the use of that medication and to agree to the use of that medication for your child, even if there's not a lot of data from children. But it's important to ask those hard questions and to learn what you can. Now, that gets to, I think, my general point. That's the last thing that I wanted to say, which is, I understand that, if I'm a parent and I'm taking my child and thinking about my child joining a research study, I'm going to be concerned about the safety of that research for my child. I'm going to ask what's in it for my child. I'm going to ask, how is my child protected? And I can understand why people might be a little bit nervous about that and want to ask those hard questions. But if I'm a parent who's taking my child in for treatment, and that treatment is cancer treatment or treatment for any other disease, I want to know that treatment has been studied in children. I want to know that the doctor has experience, has data, has evidence about that treatment in children. And that's why it's so important that we do research with children, which is so that when we as parents take our children in to be treated, we're confident that the doctor is treating our child based on good evidence about the safety and the effectiveness of that treatment for children like mine.
Thank you so much, both Dr. Carla Saenz, Dr. Steve Joffe. It's been a pleasure to have this discussion with both of you. And of course, we wanted to say a special thank you to our audience and our tech team, our wonderful tech team, working hard in the background. And we want to encourage everyone to join us next time. And to remember to check out our Facebook, Instagram, Twitter, all of our social media platforms. And of course, if you have more information about any public health question, you can also check our website at www.paho.org/en. Thank you and see you next time.